One more myth is once part of your intestine is operated on, digestion is permanently weak. Is that true? Do you agree with
Mostly
this?
no.
Is midnight biryani allowed? Like 2 a.m. biryani, 3 a.m. biryani. Consuming midnight biryani is fine?
Biryani is never bad, but not at midnight.
People taking mobile phone and sitting in the toilet for more than 15 minutes or beyond that. Is that okay? Is there something wrong with your gut?
Should not be taken to toilet.
Hello and welcome to Real Talk powered by the Apollo Hospitals Chennai. Joining me today is Dr. Sudeepta Kumar Swain, who is a senior consultant and surgical gastroenterologist with the Apollo Hospitals. Doctor, welcome to the show.
Thank you.
So much for joining us. So let's start with this basics. How much of stomach issues has actually increased because of the modern lifestyle and the food habits?
It's all related to our lifestyle. And of course, lifestyle means or includes the food habit, what we are getting and how we are eating. It starts with the family, then in our workplace and our profession where we get the food, the way, the time when we take food and from where, and balanced diet, or it is a fast food what we are getting from hotels and centers. In a busy schedule, it is very common to have completely a different set of food than what we had traditionally in our culture.
So irregular food habits or skipping meals or late night dinner and the timing of taking food, and that leads to some kind of digestion problem. Is this a myth?
Absolutely not. It is not a myth. It is actually, what I mean is, like, because of change of food habit. When you say food habit, it includes so many things. Like timely food we are talking about. So we always from like our ancient culture, traditionally also we said morning breakfast should be on time and we should take light meal at dinner, even lunch, and it should be on time and it should be home cooked, not the fast food. You take any center, whatever 5-star or even the best of the best center in your city, the food is adulterated.
You know, there's this regular food habits, then there is this Gen Z food habits. With Gen Z food habits, I mean fast food, instant noodles, protein shakes, energy drinks. What is the biggest problem with this Gen Z diet?
See, to make it tasty, we or the hoteliers or the restaurant adds lot of artificial sweeteners, oil, butter into it, which is not healthy to us. Though it looks good to our mouth and tongue, but it is not good to our belly or to the health of the particular person. So this Gen Z food what we are talking about is like, because we don't have access to good food, because we are not getting on time food from our home, we are at times forced. Sometimes it is a fancy thing to take it and be proud of. Actually, in long run, it damages almost all the internal organs. Particularly, I'm a gastroenterologist. I'll speak about liver, the stomach, and pancreas. In long run, we develop lot of liver conditions like fatty liver. We develop pancreatitis because of being overweight. And because of being overweight with this adulterated or fast food, we get cardiac conditions. We get other endocrine disorders. So we don't recommend or don't support this Gen Z food. Yeah, for taste or in a party, at times in a month you are taking is okay, not regularly.
So has these kind of complications become very common now? Are you dealing with more cases?
Yes, if you look into, just come to the liver diseases. The 15% of liver failures are present as due to obesity. And why obesity? Because we have a bad lifestyle, less exercise, and more of this Gen Z food what you are talking about. Pancreatitis, same. We drink, don't take timely food, we smoke. So all this in long run damages the pancreas and other internal organs, including simple gastritis becomes chronic gastritis, gastric ulcer, and causes problem.
So what kind of cases that you have dealt, of late because of these abnormal food habits?
See, gastritis and gas, bloating, acidity is a common thing now. People, even the name of this pantoprazole, rabeprazole, even a like 14, 13-year-old person knows now because it is so common. These are common problems, but coming to risky things or the dangerous ones like fatty liver, don't take it lightly. People, when you do a routine health checkup, we see fatty liver. That is just beginning of the damage to the liver, which is going to make it liver failure in 10 to 20 years time. These are more common nowadays. We are seeing more chronic pancreatitis conditions in younger age group, which was not there earlier. Gallstone conditions because of excessive fat intake. And similarly, many other GI disorders, we are getting irritable bowel syndrome more commonly in every family, which was not seen. So these gastrointestinal conditions have increased a lot because of our change in food habit and lifestyle.
So what kind of complaints people come up with? Because for the, if you have stomach pain or if you have pain elsewhere in your gut region, people may just take a painkiller and ignore. So, you can't ignore these symptoms, right? Look, what are the initial symptoms?
See, because what you asked is an important thing. Gastritis and gastric cancer can have similar symptoms. There are some red flag signs or warning symptoms we should be careful about, like having some dull-lacking pain, some bloating is okay. It's not okay actually. You should consult a doctor and change your lifestyle. But if you are having weight loss, started developing increased intensity of pain, you have vomiting, or you have like fever, jaundice, these are actually extremes. But at least you develop certain unexplained weight loss, unexplained weakness, and a dull lacking pain is worsening now and becoming a constant moderate to severe pain. So these are the warning signs we should be careful about, particularly for gastrointestinal conditions.
And what you said is very interesting, doctor. Now you're seeing a lot of younger patients. What are the symptoms that they complain about when coming to you? And what have been their food habits? Like, you must have done a assessment.
Yes.
So what do they tell about their lifestyle, their food life?
Their food habit is mostly, it is because of like online food carriers. Now we have this gendered food at every meal, every corner of the city. You can avail it in 10 minutes. So that has changed the young generation food habits. So what happens, instead of taking home cooked food, they are taking this fast foods, particularly like ready-made foods, like let it be burger, let it be pizza, let it be something similar to that, where it contains a lot, and in the particularly the sweet food containing high amount of sugar or carbohydrates. These are very much damaging to liver, even to the stomach lining, which we do not understand when we take. But when the disease happens, we didn't see this much of pancreatitis in younger age group 10 years back, which we are seeing now. Pancreatitis, let it be this liver condition like fatty liver. Liver failures or the cirrhosis of liver at early stage of life have become more common than what it was a decade ago.
So is gut health just a social media trend, or is it genuinely something which is very important?
It's very important. For your mental health also, you need good gut health, and it is all related. We call brain-gut axis. So it is a scientific thing. It's not a myth or a social term. It is a scientific term, brain-gut axis. That means if you are stressed, your gut health also will worsen. You will have more frequent bowel movement. You have pain because of the abnormal motility in intestine, and reverse also. If you have a abnormal gut because of, let it be food habit or a organic disease condition, you will have altered mental health also. So we should be, most important thing is lifestyle. Second is early diagnosis. How can we get an early diagnosis? Health checkups. For symptoms, instead of taking over-the-counter drug, meet a specialist, which is available in every place. Even smaller cities have gastroenterologist, have neurologist. That India has changed. And we should make like benefit of those doctors who are available next to your door, rather than searching for through internet or taking over counter drug.
That's a very big problem. We have a separate segment for that, which I'll come to you. But how badly does stress, screen time, and lack of sleep add to this problem?
Just an hour ago, we are discussing about the problem of sleep. This is not lack of sleep. It is like changing our lifestyle so that you see, somebody asked my grandfather didn't get this problem. Now why we are getting this problem? It's because of life. Like we sleep at 2, wake up at 8, 9. It is common at least in 50% of people who are working in IT or similar industries. So this changing of our circadian rhythm, not doing enough exercise, and when you go for exercise, we try to do strenuous exercise in 2 days and try to lose the significant weight, which is not possible. Exercise should be sustained, moderate exercise. It should not be strenuous exercise and should not be a sudden exposure to strenuous exercise. It can affect your heart also. Then the sleep should be adequate on time. On time in the sense this old saying, early to bed and early to rise, still valid. If it's possible, at some days we have to stay awake, but we should try to go to bed early and wake up early. 7 hours of sleep, regular fast walking, and timely home cooked food.
So that's the key.
That's it.
So here online people talk about detoxes, people talk about gut cleansing and drinking a variety of juices. Do these actually work?
Water. Instead of variety of drink, take water. 3 to 3.5 liters of water in a day, good quality water. And it should be regular, not like 4 days in a week. Every day you should measure initially and make a habit of taking 3 to 3.5 liters of water for a human being of like 50 to 70 kilo. And raised all these artificial recommendations from different nutrition organizations, we don't recommend as a gastroenterologist to go through that. Enough water, and you take traditional things like mixing with lemon, the freshly prepared juice from your place. Whenever we talk about freshly prepared juice, it should go without sugar, because that is a common thing. You go to any juice shop, they will be adding good amount of sugar to it and giving it to you. That does more harm than help. You should take fresh juice, and particularly at breakfast and at dinner, and it should be without sugar.
Okay, doctor. So there are a lot of young people who are into self-medication. You know, I've seen people who just pop up a pill and say everything will be okay. You know, is that a problem?
It has become universal. Not many. You have seen some you are telling, but it has become because of this widespread availability of internet and the AI, ChatGPT. We all, instead of asking a doctor, we search through the Google doctor to tell us what medicine has to be taken. And we try to take that. And India doesn't have that regulation to control the over-the-counter drug. Life-saving drug also is available over-the-counter. So I don't recommend taking this over-the-counter drug to check or the counter or to get relief from your problem. Because like we discussed initially, this abdominal discomfort can be because of gastritis, can be a serious problem also. For a common man, it is difficult to differentiate it between these two. So it is better to meet a gastroenterologist or any like a cardiac condition, meet
a
specialist and discuss your problem. Yes, you had some discomfort like for because you know that you had taken a spicy meal, you had some discomfort and it never came back. That is okay. But don't take over-the-counter drug and don't ignore your symptoms if it is persisting.
One question or one honest question. If you think the Gen Z population should do away with one habit to protect their gut, what should that be?
I will be repeating the same. It should be, whenever you talk about food, we should be home-cooked food, at least homely food. It should be, and mostly, because sometimes it is difficult to control it because we have parties, friends and all. We are not restricting that. But as long as possible, timely food, homely food, and it should be a balanced diet and some moderate exercise. We are not telling like 2 hours exercise every day. 40 minutes of fast walking, 4 kilometers coverage. If you can do every day, 6 days in a week, along with what we discussed about the food, it will be good enough for having a good health.
If you don't maintain a proper food habit, what kind of complications it leads to? Like before this interview, you were talking about some serious complications. Like let's break it down to what it leads to.
So like we are not controlling this fast food, and because it is little tastier than what we get in home, we keep taking those. We may land in fatty liver, gallstone conditions, chronic pancreatitis, pancreatic stones, and you won't believe obesity is a precancerous condition. Obesity, particularly when your BMI is more than 30, it is a precancerous condition for your large intestine, for pancreas, for even for the stomach and the liver also. So if you keep without control, you keep taking those diet, you will land in pancreatic condition like chronic pancreatitis, stone diseases in the pancreas or in the gallbladder, even fatty liver and liver failure.
So I know misinformation has made things difficult for you as well as for us journalists. So we have a separate segment for countering misinformation. So myth versus reality. So here are some common things that internet throws up. All stomach problems are caused by spicy food. As a surgical gastroenterologist, what is your take on this?
No, spicy definition is different from different for different regions in even our country. So what is spicy for a person in West Bengal may not be spicy from a person who is from Tamil Nadu. So the spicy definition is different for different regions. But if the spices are made at home like what we do in South India, so that is a better way of taking spices, making the food spicy than these artificial spices who are packed in tin and adding in our food. So I'll recommend, if you're talking about spicy food, it is not always bad, particularly if the spices are prepared properly and either homely prepared.
Party making spicy.
Party making, that internet or the YouTube, sometimes we see how to prepare. We see a lot of artificial masalas, which those are not good.
So there is another myth that generally people believe. If you have acidity or gas very often, it is normal and it is harmless. As a gastroenterologist, what is your opinion on this?
Acidity and bloating is not normal. It is never normal. If you are having once in a while because of some party food or those fast food, that is, and it subsided within days, it is acceptable. But if it is persisting in your life, even if it is for weeks, no, it should be days and it should subside within days. If it is persisting for weeks, then you don't take it lightly. It can be an early sign of a major disease like let it be a gastric ulcer, even gastric cancer.
So this happens because of your food habits, or it is an indication that there is some inflammation in your body?
No, it's just because of food which you have taken for a day or two, it will subside. But if there are changes in your body which is causing this type of discomfort, it will persist. It is not going to disappear after a few days. So if it is persisting, you should be careful and should not ignore it.
So as a gastroenterologist, how do you see this? Digestive problems can always be fixed with home remedies. Everything can be sorted.
Some can be sorted, some may not be able to. We may not have home remedies. So we should not try everything to deal in taking indigenous things and try to resolve it. There are something we have still, like turmeric, using turmeric for our wound, taking turmeric and milk, trying to get relief from our GI conditions. So those are good actually. These are good habits and it is there for decades and centuries. But this is not the answer for every abdominal problem.
Do you keep getting these questions time and again when you see patients?
This indigenous...
all this, whatever I have asked, because these are all things that are there out there.
At least 40% of people, they ask about it and they have tried it.
Okay.
Because we are in a tertiary center, we get filtered patients who have already tried, already have gone to a primary care doctor and coming to us. But if you go to a primary health center, it's more common. People who they try home remedies, and even some of them don't believe in allopathy.
That's another big problem. I think that we should have a separate discussion about it. There is another myth that generally people believe. Gastroenterology surgery means a big cut and long bed rest. As a surgeon, a gastroenterologist, is this true?
It has completely changed. That is what I'm a robotic gastrointestinal surgeon. We do robotic surgeries. Actually, robotic surgery means what we call keyhole surgery. It is a modernized way of doing keyhole surgery. So keyhole surgery is laparoscopic surgery where you have long instruments and you put the instruments through small holes in the belly and operate. Robotic surgery means same keyhole, but the instruments are different. The way we operate are different. These are wristed instruments, means the instruments move like hand inside the belly, and those movements are controlled through software. The surgeon will be operating. It's like a video game. You are playing, you have joystick and you are moving your fingers, and the same movement through software gets transmitted into the patient body through robotic arm. You control. It's like a master and slave. You control, and so what happens? The complex surgeries which we were not able to do through laparoscopy, now we are able to do with robotic systems.
Okay.
And there is a myth still that robotic surgery is very costly. Yes, it is costly, not very costly. The cost has come down over time because there are multiple robotic platforms are available. So the initial monopoly of the robotic system has gone. We are doing a lot of money. Even a simple surgery like hernia to complex surgery like gastric cancer, pancreatic cancer, we are using robot and doing it so that those big cuts won't have. Patient will have less bleeding, no functional damage, early recovery. He can join back his work comfortably within days, and the pain will be less.
So what is the outcome of these surgeries? Like how perfect these surgeries, the results of these surgery?
Initially, when robotic surgery came in United States, there was some hiccup telling about the safety of it, and there were some incidents because probably that time it was not that matured enough to be launched. But presently, it is completely safe, and people who handle it, they are experts. They have been trained like you get a pilot before driving, you get a lot of simulation before taking the flight. We do a lot of simulation.
Okay.
So then only we use the robot and operate on human. So there is a simulator training. So we do like thousands of simulations and the same surgical techniques, and then we take it into the patient. And I don't recommend like a youngster or the young doctor who is just passed out to start the robotic surgery. Rather, it a trained person, senior person to start, so that this safety issue won't be there. And it is safe. Now it is completely safe with all advantages.
Okay, that's great. I've been talking to a lot of doctors about robotic surgery. So how willing are the patients to go for it?
Now patients are asking, even online they are taking appointment. Doctor, I'll reach 15th, 16th, I want robotic surgery. So I don't know how much they know about it, but same, they have gone through so much data is available in online, even scientific data. They must be seeing that robot, what is the advantage of robotic system. So I don't think people are hesitating for robotic surgery. Maybe 10% they are hesitating, but 80 to 90% once we explain how it is, they agree to that.
Right, doctor. So one more myth is once part of your intestine is operated on, digestion is permanently weak. Is that true? As a gastroenterologist, do you agree with this?
Mostly no. We cannot say a blanket statement no, but it is mostly no means like commonest surgery in gastroenterology is gallbladder stone surgery.
So gallbladder removal does not ruin your digestion? No way.
No way is but 95% of patient, it won't cause any issues. Even those 5% whom I am telling, they will have very minimal symptom which is not affecting their routine life. This is actually like you get an organ which has minimal function, and when you remove it, this minimal function is taken over by another organ. So it doesn't change in digestion. Gallbladder is not a very essential organ in our body.
So there's this one myth which I feel like this is my favorite. Only old people need gastrosurgery. Is that true? As a surgical gastroenterologist, what is
surgery? We being a surgeon also, I don't want to operate a patient. Means like we are not interested or we not recommend surgery just like that. Surgeries in abdomen are more common in older people. This statement is correct. But younger patient also have diseases or the surgical condition where they need surgery. Why older people need more surgery? Cancers are more common in older age. The stone diseases are more common after 40. So the older people get more surgeries and surgical conditions. But in India particularly, it is like a chance to speak about it. The cancer is relatively more common in younger age group than what we see in Western population. Let it be gastric cancer. Gastric cancer is more common in younger age group. Means like if you take like 20 to 30 years of age in Western population and Indian population. Indian population will have more cancer in younger age group. So that is a lot of things mixed in that. Change in food style and the genetics or the racial differences. So that is why younger people are also exposed to surgery and they are not even for surgery.
Doctor, lastly, I have two questions for you. One is midnight biryani allowed? Like 2 a.m. biryani, 3 a.m. biryani, consuming midnight biryani is fine?
Biryani is never bad, but not at midnight. So,
thank God.
So, when you talk about midnight, we are now coming down on time. I am from eastern zone of India. When I came and now on almost more than 20 years I am here. I saw one lifestyle here that people eat, you go to traditional families, they eat quite early. The dinner will be quite early. 7 o'clock, 7:30. That is the best thing what we should recommend. Dinner should be before 7:30, 8 o'clock. At least 8 p.m. Beyond that, if you are taking dinner, any food, even munching something like snacks is not good for your health. Then definitely food like biryani, it is a heavy food. Taking at midnight is not going to help. It will damage your health. So you should avoid taking midnight food. It is nothing to do with biryani. Biryani is we love biryani.
What kind of damage it will?
If you take that, you're starting from your gastritis symptoms, irritable bowel syndromes, even your like changes in the blood level of lipids, everything will change in long run. You took it once, like a marriage party or something, it's okay. But you keep doing that 3 times in a week, is going to harm you.
My last question. I think this question, if you put this as shorts, it will go viral. People taking mobile phones and sitting in the toilet for more than 15 minutes or beyond that. Is that okay? Is there something wrong with your gut?
I know people who sit in toilet for hours.
Oh.
Okay, so but
are there cases that you have dealt like this?
Yeah. And particularly you will see the patient won't say. His relative will tell, doctor, he is sitting in toilet for more than 2 hours, more than 1 hour. So it is the gadget, books should not be taken to toilet. We should take lot of water when you get up. If you take, you can take good amount of water. Do some walking. It is good. And toilet, sitting in toilet more than 15 minutes is abnormal. It's going to cause diseases like fissure, pelvic floor dysfunction, piles, all those. So if you are not able to clear or the feel incomplete, come out of it. Go again. There is one teaching or the physiological training called biofeedback. It's not a medicine, it's not a surgery. It is like training you how to pass stool easily without causing damage to your pelvic floor. That is available in multiple setups. Even in Chennai, we have many centers. So where you get trained and pass motion comfortably and within 15 minutes. Anything more than 15 minutes is abnormal. Come back, go for a walking, take some water, then try to go again after some time.
Okay.
Don't wait there for longer duration, because once it becomes a habit, it will be a habit for life.
Okay, I can see many people raising their eyebrows in this row. Thank you so much, doctor, for being here, joining us and giving us your valuable insights on this issue. Thank you.
Thank you. Nice talking.